Hello listeners. I will be talking on language barrier as one of the issues in migrants and threats to healthcare in Malaysia. Migrant workers generally face greater health risks than non-migrant workers. This likely is driven by some of the following. Some migrant workers, especially those migrating from developing countries, typically migrate from countries with poor health systems where communicable diseases are not adequately addressed. Migrants often are employed in industries that involve dirty, dangerous, and degrading work known as 3D industries and bring with them increased occupational health and safety risks. Migrants also tend to take jobs in informal, lightly regulated sectors of labor-intensive industries. Sometimes these jobs are temporary or seasonal work where health regulations rarely are applied or are not monitored. Language barriers can prevent migrant workers from utilizing available health services offered by employers. Migrant workers often lack access to local health systems such as hospitals in destination countries. Due to a fear of being expelled from employment, migrants tend to tolerate harsh working and living conditions longer than others. To keep generating income, which in turn enables them to pay back debts incurred during migration. Migrant workers sometimes tolerate overpriced, crowded, and substandard housing and living conditions. Issues at phases of migration. Pre-departure and transit. This phase includes health risks and poor health system in origin country, and cultural beliefs and norms which impact health. Post-arrival onboarding language barriers, 3D industries health risks, lack of access to adequate healthcare services. Integration inadequate living conditions, inadequate nutrition, greater susceptibility to mental health strains. Return lack of awareness of medium and long-term illnesses can leave workers at heightened risk upon return. Language barriers, potential negative effects of language barriers in healthcare. Misunderstandings and difficulties in uncovering misunderstandings. Problems with giving preventive health information and in getting informed consent. Difficulties with involving patients in their treatment and decision-making. Inadequate comprehension of diagnosis, both over or under diagnosis. Inappropriate treatment or lack of treatment. Over or under use of healthcare services. Increased use of unnecessary diagnostic resources. Less adherence. Frustrations and less satisfaction on both sides. This diagram shows a clear picture of language barrier. The patient does not fully comprehend what is being said. The patient's ability to report important and accurate health history or the physician's ability to understand and assimilate patient's information is compromised. For example, the case of Bangladeshi migrant workers in Malaysia. Although the migrant workers have acceptable levels of proficiency in broken Malay language, it is far different than expressing them in proper symptomatic narration about the etiology of a disease. They cannot properly explain the etiology and symptoms of disease, making them often very reluctant to visit the hospitals in Malaysia. When these workers are unable to explain their problems, they simply blame the Malaysian doctors, saying that their treatment is not proper. Cultural barriers might arise in meetings with migrants depending on what patients bring to the consultations, such as their personality, earlier experiences, habits, attitudes, beliefs and prejudices. Thank you.